Hi guys, today we will discuss about some important syndromes. First of all, discuss about Down syndrome. As we know that there are 46 chromosomes in a human being, but here in Down syndrome there are 47 chromosomes. That is one extra chromosome. So this one extra chromosome is in chromosome 21. So it is also called trisomy 21. Now, what are the features of such patients? If we talk about the face, there are upward slanting palpebral fissures with epicanthal folds, and there is flat occiput, and then after that there is a protruding tongue, low set ears, low neck, and as far as hands are concerned, there is a single palmar crease, and the gap between the first and second toe is pretty high. And then after that, this is the real picture of a Down syndrome child. As you can see, that occiput is flat and palpebral fissures, they are upward slanting, and there are epicanthal folds, and the tongue is protruding out. So, if we discuss Down syndrome system wise, we can see that there are typical facial features which we have discussed. Then they are short heighted people, and there are developmental delays. Then there are gastrointestinal abnormalities like duodenal atresia and Hirschsprung disease. And in heart abnormalities, patients usually have endocardial cushion defects, and then VSTs, ASTs, tetralogy of Fallot, and PDA. Then there are certain complications in patients of Down syndrome. These are subfertility, and then hearing defects, and then low intelligence, and there is increased risk of lymphoproliferative malignancies. Usually, the chances of Down syndrome is increased if mother's age is increased. The chances of Down syndrome is 1 over 1000 if mother's age is 30 years, and then for every 5 years, which we can add in 30 years, that is 35 years, then 40 years, then 45 years. What we do is that 1 over 1000 is the chance of having Down syndrome kid in a woman or in a mother of 30-year-old. Uh, so we divide this denominator of 1000 with 3 by 3 for every 5 years. So this is how we calculate the risk for every next 5 years after 30 years of age of giving birth to a baby with Down syndrome. Most common cause of Down syndrome is non-disjunction of chromosome. Second number common cause is mosaicism, and then third is Robertsonian translocation. All these are very technical terms. You just remember that non-disjunction is the most common cause of an extra chromosome in the zygote. Then after that comes a noonan syndrome, which is because of problem on chromosome 12. It is just like Turner syndrome, same features as that of Turner syndrome, but some of its own features too. For example, a patient can have pulmonary valve stenosis, then ptosis, triangular face, low set ears, and some behavioral abnormalities. After Noonan syndrome, we have got prader syndrome, and which is because of the abnormality in chromosome 15q11-13. And if this problem of chromosome is from father, it is called prader syndrome. If it is from mother, then it is Engelmann syndrome. Now, what are the characteristics of prader syndrome? Is that patient is usually short stature, he is of low IQ, and he's having hypogonadism and obese, and all these are the problems of prader syndrome. After that, we have got Williams syndrome. Williams syndrome is because of microdeletion of chromosome 7, and usually patient with Williams syndrome, they have got alpine-like face, I mean very mischievous face, and then after that they are very friendly and very social, and they have got low IQ, and they can have transient hypocalcemia.